Our focus question for this meeting today is to really focus a bit on the current drug trends that are impacting our community. And that is why we have invited our law enforcement experts to share with them what they're seeing and hearing on the street. We're also going to ask you in some small breakout rooms to share what you are hearing in your sector and in the world that you work in. So that's where our focus is going to be today. So I am now going to welcome and invite in the room our wonderful County Executive, Paul Farrow. I snagged Paul at a fundraiser and said, hey, can you join us again? And he said, absolutely. So I think we're going to make this a little bit of our quarterly meeting. I really would like our county executive to share a little bit about what the county is doing to fight and battle the opioid crisis. And of course, he knows what we are doing. And I'm going to turn it over to you, Paul.
Thanks, Terry, and good afternoon, everyone. I'm going to give a really high overview because you have a vast majority of the team that got me the information already on this call that you can touch out and relate to when you look at everything that they're doing. But actually, this morning I sat down and talked with Liz Aldred, our director of HHS, and she gave me an update on what the task force has been doing, what's going on. There's some great news. I know with the work of John Kettler and others that are on this call, we're getting the information out. And one of the things I'm excited about is we call them the OAK kits. I've been talking with some people and we're thinking about hoping we could consider changing the name from overdose aid kits to opioid aid kits. Because our goal is not to work with the overdose. Our goal is dealing with fentanyl, which is a poisoning. And how can we kind of start differentiating what's going on with that? But to suffice to say, we have 75 of the first 100 kits already out in the public. And our goal is to get another 125 out. We're working on some other ideas as we move into 24 and expanding the opportunities to have Narcan in the public and how the public is going to be made aware of that. So hopefully that's some stuff we're working on as well. Other areas that you're seeing, we've got partnerships that are out there with the SOFA team. We have our 988 run coming up this Saturday morning. If anybody wants to do a nice 5K run out in Oconomowoc, it's our way of bringing awareness to the suicide issues and more awareness to 988 number. We're the first organization in the country that's had these 988 runs. We had our first one last year. So I think it's a great opportunity to get the message out on that. The other things that we're looking at is really creating more partnerships. The Love Logan Foundation wants to get into the schools. We're going to be working hopefully this summer to get Narcan into the schools, get training to the staff, and really start building that awareness of what the fentanyl poisoning is, how it impacts, and how it can be prevalent in some medications, drugs that the kids might be using, and how we can get that information out to the parents and to other friends to inform people of what's going on. So it's been an incredible effort. I am not doing Liz justice in the 45 minutes that we talked this morning about everything that is happening. All I can say is we are pushing the envelope as much as we can from the county perspective to bring the awareness, bring the understanding of what fentanyl opioids do and how we can turn the tide on that if we work together. And I know that's one of the great things with this task force is bringing these like minds together to help each other out, to get the message out there and get the solutions out there as well. So I appreciate all your efforts that you're going through, and we'll continue to partner with you through the team that we have on this call. And if anybody's got anything for me, they're more than happy to reach out, touch base with me if they need me at events. I'm willing to come to anything to help us continue to increase the awareness and the understanding of what's going on with the drugs in our communities. So Terry, with that, I'd bring it back to you.
Thank you so much. And we are really grateful for all the efforts you are spearheading and so glad to have you here. We really appreciate it. And these little updates are really important to us. So thanks again for everything you do. I am going to now invite, and I'm going to just share my screen real quickly here. Our agency spotlight today is the Wisconsin Voices for Recovery. So what we are doing this year is each quarterly meeting. We are inviting one of our partners to provide an update and talk a little bit about the work they're doing and where we as partners can possibly intersect. So if you are interested at all in being September's Heroin Task Force partner, you can send a little note to Tristan Bruno and we can get you on the calendar, and we'll pop her email address in the chat in a moment. So I would like you to please welcome Cindy Brzezinski, the Executive Director, and Fred Garcia, who is the Justice Supervisor for Waukesha County, and he also is an advisory council member for Wisconsin Voices of Recovery. So I am going to stop sharing my screen, Cindy, so you can, and we'll make sure that you are a co-host so that you are good to go. And it does look like, is she good to go there? Just see. Yep, you are good to go to share your screen. Perfect. That's great, Cindy.
Perfect. All right. So, yeah, I'm happy to be here. My name is Cindy Brzezinski. I'm the Director of Wisconsin Voices for Recovery. We are a part of the UW-Madison Department of Family Medicine and Community Health at UW-Madison. And then we also have Fred Garcia here. I don't know, Fred, if you want to introduce yourself a little bit.
Sure. Fred Garcia, Waukesha County Department of Health and Human Services. I'm an advisory council member for Wisconsin Voices for Recovery. So I work with Cindy and the rest of the team on for Wisconsin Voices for Recovery.
Right, great. So here's just a quick snapshot of our current team. So we've got a principal investigator, myself, a community liaison, and then leads of the different programs here. So we have an engagement coordinator focused on BIPOC communities, ED2 Recovery Plus program coordinator, our naloxone program coordinator, and then we have another program specialist. We also have students working with us on occasion, helping to move our mission and initiatives forward. So Wisconsin Voices for Recovery, we are a statewide recovery-focused organization. As I mentioned, we're part of the UW-Madison. We did start in 2013 with over 20,000 people reached. And the team structure is 7 team members, 4 programs, an advisory council that Fred is a member of, and then a BIPOC community advisory committee. The advisory council meets monthly, and the BIPOC community advisory committee meets quarterly and advises on our objectives, initiatives, etc. So our main goals are to connect people across the state, reduce stigma, increase access to harm reduction. Our ED2 Recovery Plus program, which provides support, a program and funding to organizations that provide peer support to the EDs, and then also referrals from the community. And then education on a variety of topics. So I'm just going to go through some of the things that we're currently working on or have in the works, including some opportunities for you all to become involved if interested. So we have the Rally for Recovery. We do that each year. This year's rally is going to be on Saturday, September 9th. It will be in person. It'll be at the state capitol. We're very excited about this. This year, again, last year we incorporated a new wellness component, which includes hobby tables, which are tables that people can go to and learn a hobby to help support their recovery. So it could be anything from mindfulness to knitting to drawing to photography, anything that someone could use to support themselves. We have stigma awareness events. This is a new thing this year where we collaborate with others across the state to hold an awareness event, a larger event where we have co-hosts, we might have speakers, we have different activities. We do have one in the works, so keep your eyes out for a flyer on that, which we would post on our Facebook page and in our newsletter. We also do some social media engagement. So on Facebook, YouTube, SoundCloud, we do a Saturday night chat on our Facebook and YouTube. And that's where we interview somebody who is in recovery to have them share their story to help connect with others, show others they're not alone, and reduce stigma. We have a sober podcast. Stories of Badgeries Empowering Recovery is what that stands for. And we do that monthly as well. That includes organizations, kind of highlighting an organization and what they do to support the recovery community, and or we focus on specific topics like stigma, women in recovery, etc. We also provide sponsorships to various events. We do have a limited number of sponsorships each year that we can give out. And we collaborate with organizations across the state on their events and on other efforts. We are going to be developing a peer support directory. This is something that we are developing the survey currently. We're going to be distributing that survey to see who might be interested in being included in that directory. Once that's completed, we will have that directory available for anybody to look at, to identify what other resources across the state for peer support, getting connected to somebody that can provide peer support. And we also work to reduce stigma. We have stigma reduction campaigns, and we have one going on very soon, focusing on stigma reduction in BIPOC communities with respect to opioids. We do trainings and presentations on stigma through education, and then also through sharing personal stories. And then we have a series called Speak Out on Stigma. We interview people in the community about 5 to 7 minutes. We ask them a question or two about stigma and learn their perspective on that. So that's another opportunity that you could become involved in. We are very interested in obtaining as many different perspectives as possible to show the impact of stigma and to show that people are speaking out against stigma. We provide education and training on topics such as recovery, addiction, stigma, harm reduction. We provide free CCAR recovery coach trainings and then advocacy. Our next recovery coach training will be in August. The flyer will be coming out in the coming weeks. So keep your eyes open for that on our Facebook page and in our newsletter. And then we also have ED2 recovery program. So we provide funding for peer support providers, organizations that provide peer support. We have, as part of that program, regular monthly group and individual site check-ins, quarterly coach call-in, where coaches, peer supports call in to learn a variety of different skills, increased skills. Some of them are more didactic and some of them are more experiential. Like we go through, let's have some scenarios that talk about ethics. What would you do in this situation? What would you do in that situation? And then we also have real life scenarios that they bring to the table and we kind of talk about together. We also provide an annual supervisor training, and that is regarding topics that the coaches participating in the program or the supervisors participating in the program would like to hear about. So we find speakers for that and cover those kinds of topics. And then we have a virtual peer support conference that is annual. It's open to everybody, virtual, open to the public. Those participating in the ED2 Recovery Plus program, however, get to choose the topics for that. And then we find speakers as well. And then we also provide technical assistance to current organizations and organizations that are looking to learn about the program or become involved. I will say that it's not required to be funded by us to participate in this program. And then we also have harm reduction focus. So part of that is our naloxone program, where we provide naloxone boxes to the community for free to increase or decrease the risk of opioid overdoses that are fatal and increase those harm reduction supports across the state. We also provide Narcan to the community for free. We currently have a partnership with Narcan Direct. And we provide Narcan administration trainings. We do those regularly, virtually, twice per month, the second Wednesday of the month from noon to 12:30, and the fourth Wednesday of the month from 6:30 to 7 p.m. And anybody can call into those trainings. They're done over Zoom, and we posted about those on our Facebook page. So they're pretty well known. And then we also have a fentanyl tester program, which is coming soon as well. Here is our main contact info. So we have our main email address, Wisconsin Voices for Recovery at famed.wisc.edu, our ED2 Recovery Plus program email, our naloxone email, and then here's our social media and website links. So we're on Facebook, YouTube, SoundCloud is where we have our podcasts, and then our website is listed below. So I'm going to turn it over to Fred to add anything about his experience with this organization, participation in the advisory council, or anything else he'd like to add.
Thank you, Cindy. Again, Fred Garcia, Waukesha County Department of Health and Human Services, and I've been involved with Wisconsin Voices for Recovery for about 13 years now. and really enjoy the collaboration statewide as we look at stigma reduction and recovery for individuals struggling with addiction. And one of the things I think that's been most impressive to me is the statewide collaboration between all counties in the state of Wisconsin as we work together to promote recovery. And one of the other things I think that's really important is the work that we're doing with the BIPOC community. It's really, as you all know, a huge gap in terms of providing services to BIPOC individuals in our state and our communities. And so Wisconsin Voices for Recovery has really done a great job of trying to meet those gaps and make sure that recovery is possible for everyone in the state of Wisconsin. So my experience has been very positive. I've met a lot of very compassionate, competent professionals within Wisconsin Voices for Recovery. I've seen a number of different leaderships within the group. And always have been very impressed with the way that the organization has been run. And for Waukesha County to be a part of a statewide organization, from my perspective, has only benefited the residents of Waukesha County and all the residents throughout the state of Wisconsin. So I would encourage anyone who's interested in being an advisory council member to check out our website. There's application forms there and information on how you can be involved in the program. Back in the day, we did meet in person. Now we've been meeting virtually. So in terms of a time commitment, I go to a meeting once a year. I help sometimes plan the events at the state capitol, and I do whatever else I can do to support the organization. But many opportunities for those of you who might have a passion or a specific group that you like to work with, I would highly encourage you to check out our website and become a part of Wisconsin Voices for Recovery. So thank you very much for your time. And again, Cindy, outstanding job with Wisconsin Voices for Recovery. It's a great collaboration, and Waukesha County is very proud to be a part of that collaboration.
Thank you both so much for being here today. Cindy and Fred, I hope you can hang with us for the rest of the meeting. There's going to be some really good information being delivered. And I will also reach out to both of you. Your presentation, Cindy, resonated because our action teams are focused on stigma reduction and support recovery. So thank you for that as well. I am actually going to, Susie, you have a question. I see your hand raised. I'll let you ask that and then we'll move right on to the next step. You bet.
I just wanted everybody to know that Voices for Recovery, I'm on the advisory council as well, but Voices for Recovery last year, one of our initiatives with the Heroin Task Force, our action team for stigma reduction, they were part of it. We have nalox boxes in all the probation offices. We have nalox boxes here at WCS. They come and replenish them when we need them. And they also are sponsors for our recovery picnic in September. So we're pretty well connected.
Susie, thank you so much. And we did put their website into the chat, and I'll be sending it out along with the recap as well. So Susie, thank you for your additions. I appreciate that. We are going to turn it over to Mary Simon, who's going to share the new Heroin Task Force website that is part of our relaunch here. So Mary, I'm just going to turn it right to you.
Yeah, welcome everyone. So glad to see so many faces here. Elevate is pleased to be able to partner with the Waukesha County Heroin Task Force and host their website for them. So it is up and running and pretty well updated. You can find it at www.wchtf.org. On there, each action team has their own page that gives information on what they are working on. There's also information about the community partners meeting. So if you're looking for the date of the next one, you can check out the website. Leadership members are there as well, so you can see who is involved at the leadership level. If you have questions, ideas, thoughts, or want to get involved, and it's an easy way to access us. So there's lots of places for you to go. Just click on a link and email us if you want more information. So please spread the word, let people know that it's out there and it's a resource to learn more about what the Heroin Task Force is doing. So
Mary, thank you. And again, special thanks to Elevate for hosting it. And Mary Simon herself has spent, I keep sending her content and she keeps putting it up for me. So we are really, really grateful for that. And I would encourage you all to check it out. We're putting our past meeting recaps there as well. And then of course the action team work as well. So thank you so much, Mary.
No
Appreciate it.
problem.
All right, and we're moving right along. We are really excited to bring an update from the Public Health Department, Ben Jones, Francis Thomas, Stephanie Engel, to give us an update on the overdose fatality review relaunch. We've been working very hard in 23 with a plan to relaunch that OFR in the 2024 timeframe. So Ben and Stephanie and Francis, I'm not sure who's talking.
Yeah, I can
Great.
take the lead here.
Terrific.
Just to give a brief update, so OFR, Overdose Fatality Review, is a process that actually Waukesha County started right prior to COVID. We conducted one overdose fatality review, then COVID hit and everything kind of went out the window. But we're happy to say we're on the path to restart that process. And actually we learned a lot the last time around, and think we have a much better process in place going this year. So what we're actually looking to do, and we'll have more data later this year, is to do a deeper dive in the data for the last 5 years of overdose fatalities. So we have a really strong partnership with the medical examiner's office and access to that data. And then we're also going to be starting doing a bereavement support for families and next of kin interviews, which will give us much more deeper data that will allow us to have more effective overdose fatality reviews starting in 24. So right now our plan is to kind of set this system up and start providing that support to families, and then actually do the overdose fatality reviews in 2024. But again, with our deep dive in the last 5 years of data, we're hoping to provide a little more insight on who is actually dying and what kind of trends are we seeing in Waukesha County. So obviously this is a huge group effort. Francis Thomas, one of our public health supervisors, has been leading this. Stephanie Engel, our new public health social worker, is really doing a lot of the work to make this happen. So obviously I wanted to call them out. And also Lisa Roberts has been helping clear barriers and make this happen behind the scenes. So this is the team. You will be hearing a lot more about it. I don't know, Francis or Stephanie, if you have anything to add.
I don't have anything to add. I think you did a good job summing it up, but we're really excited. And as Ben said, Stephanie has been doing so much research into figuring out how we can do this the best for Waukesha County and really have good outcomes. So I'm really excited for 2024.
Fantastic, Francis. Thank you. And Stephanie, we welcome you to the team. We're so excited to have you as well.
Thank you.
All right. Thank you so much, Ben, Francis, and Stephanie. We're looking forward to. Oh,
Terry, excuse me. There was a question in the chat
you
from
bet. Let me
Christine
back up here.
for the team.
So Christine is asking this is a great question, Christine. How far back are the overdose deaths that you will be going back to for the interviews? Do you want to give a 2-minute overview of kind of what the plan is?
Yeah, so Francis and Stephanie have been doing a lot of research on best practices. You know, we're not trying to recreate things. We're trying to learn from what other people have done. And it really seems that right now, the best time to outreach a family for that bereavement support is probably 6 weeks after the loss. And then we're looking to do next of kin interviews about 9 months after that loss. So we haven't decided exactly when we're going to start those next of kin interviews. Obviously, laying the groundwork and doing the outreach at the bereavement kind of provides that initial contact, which then potentially makes us a little more of a familiar face when we attempt to do next of kin interviews, you know, multiple months later. But really for the historical data, going back 5 years of data, we're simply looking at the data. We're not gonna do interviews going back that far.
And I guess want to mention one last thing. As a result of these overdose fatality reviews, part of the process is to work with a multi-sector group around the table to develop changes, recommendations, et cetera. But they're also really looking at systems level change. And we see the Heroin Task Force as the partner that a lot of these recommendations may be flowing to. So there will be a direct link with the work of the Heroin Task Force. Okay. All right. Thank you guys so much. All right. So deep breath. That was a lot in 30 minutes. So we have heard from our county executive. We have heard from our Wisconsin Voices for Recovery. We've told you about the website launch, and we're hearing about the OFRs that are coming. So now we are going to step into some of the work of the action teams. We have 4 action teams for our Heroin Task Force. And so I'm going to just share my screen and get us to that point. And we're going to do some brief verbal updates from 3 of our teams. And then we're going to spend a little bit of time with our metrics and measurements team this quarter. In September, we are going to kind of put our focus on these teams and give us an opportunity to hear what they'll have done a little bit more work up to that point. And then you can also see where you can engage a little bit more, as well as how you can help them out with their work. So we have 4 action teams: stigma reduction, support recovery, the CHIP substance use action team, and metrics and measurements action team. And I want to just take a moment to recognize and thank our leadership for each of these teams. These chairs have done quite a bit of work pulling a team together, working on helping them develop charters and honing in on the work that they will be doing. So we are super grateful for their work. And I think at this point, I am going to maybe start, Colleen, with you and Joy and Jacob for the stigma reduction action team. And the questions we've asked them or prompting them to is to share a little progress to date, maybe a win at this point, if you're looking for any particular skill sets. And then if anybody has any advice or thoughts for them, we'll just have you put something in the chat or raise your hand. And I think I'll just maybe ask for one representative from the team to start, and we'll go from there. And Colleen, I think for the stigma reduction, I'm going to ask for your report out, and I'm going to stop sharing so we all can see each other.
Okay. Hi, my name's Colleen Allen, and I am with Pro Healthcare. I'm a social worker, and I co-chair the Stigma Reduction Action Team with Joy Evans and Jake Jansen. We met for the first time last month in May, and we had our first meeting, and we meet again next week for our second meeting. We got a lot done actually in the first meeting. We pretty much put together our team charter for our action group. Next week, hopefully we will revise and finalize it. It's up on the website, so you can see where it is there. Jake took the lead on that, so thank you, Jake. The other part of our meeting last time was more brainstorming, looking at what do we want to do or accomplish in our action group. And one of the areas we looked at was harm reduction and the message that harm reduction saves lives and education saves lives. And I think we're going to lean on to the metric and measurements team to get some of the statistics that shows how harm reduction does save lives and lets people have the chance to get into recovery and be productive and have their life saved and not die, because the alternative to that is possibly overdosing. The other one we wanted to look at was messaging, and as far as one of them was addiction can happen to anyone, to any family. Possibly looking at doing some social media videos, personal stories, sharing that out there. And the other thing we looked at were words matter, looking at terminology and what is the appropriate and current terminology and who would we want to share that with. The other thing that John Kettler graciously did this because he connected me with Rachel Cooper from Shatterproof, and they have a toolkit that they developed for stigma reduction. And we did connect, and I am going to meet with her next week and talk a little bit more and hopefully invite her to be at least a speaker, or if she's interested in joining our action team, to have her come and talk with us too. Again, not to recreate the wheel, but to see what they have and what we can do for Waukesha County. And if there's anyone else out there that's here today listening that's interested in joining our group, please let us know. We welcome everybody. So thanks.
Colleen, thank you. Thanks so much. Appreciate it. Any comments, questions, or maybe we'll move on? See if anybody has anything. I haven't seen anything in the chat. Thank you so much. All right, our next group is the Support Recovery Action Team, and that is James Hishma from Rogers Memorial, Susie Austin, and Amanda De Leon. Susie, Amanda, I know you guys are here. I don't know if Jim was here. Who is our representative speaker from your team?
That would be me.
Excellent. Thanks, Amanda.
So we met for the first time as a group last Friday. So that group was just a brain session dump kind of a meeting, just to figure out what path do we want to go on. Because we know just because things were worked on last year doesn't mean that we're going to carry those onto the new year, onto this new year. So we're just trying to figure out where we're at, what the needs are. There was a lot of talks of providing support in the jail system there in Waukesha County, talks about peer support, talks about family support, just all of that in general. So we just got to figure out where do we want to focus on, what's and then figure out action items after that. But yeah, we were able to meet for the first time last Friday. We were super excited to get everyone's schedules aligned, and super excited to figure out where this is going to lead us.
Great. Amanda, thank you so much. We're looking forward to seeing what you all come up with. Fantastic. And as the Wisconsin Voices of Recovery were presenting today, I was chatting with John Kettler, and I said, wow, this is really aligning with the work of the Heroin Task Force. So that's really exciting. The next team is the CHIP Substance Use Action Team. And I don't believe we have anyone representative from that team here. I just did a quick look.
I'm here.
Oh, Bree, you are here. I did a quick look and I didn't see. Fantastic. Bree, thank you for chiming in, and I'll move to you. And you might want to give a 2-second, what the CHIP is and how that's working with the Heroin Task Force.
Okay. Hi, everybody.
Some people might not know what the CHIP is.
Yes. I'm Bree Lopez, supervisor at Waukesha County of our integrated services. And yeah, our action team has met a couple times. So we're part of CHIP, which means that we are part of our public health. They have steering committees with a few different topics. One is substance use. So they've combined the Heroin Task Force and that action group. The other ones they have are mental health, and healthy aging. So that's been, probably the main focus right now of our group is kind of figuring out what does that mean to be part of these two different teams, and helping people on the team to know. So we've got some members that really understand kind of the public health side, and we've got other ones that are really familiar with our Heroin Task Force. But one of the things is the CHIP steering committee has identified 10 unique health factors. So we're really considering these when we're looking at what we need to move forward. So making an impact, I'll just read what those 10 are. It's economic stability, reliable transportation, food security, affordable housing, affordable childcare, social connectedness, health, social interactions, communication, accessibility of resources, and then workforce challenges. So we will be looking at the group of opiate users in Waukesha County, and then kind of focusing in on one or maybe two of those unique health factors. So CHIP has a very specific process to go through, and we are all learning this because none of us are familiar with that. So we're learning that at the same time. But really that first meeting, we were getting to know kind of that CHIP process a little bit, getting to know our group members. Our last meeting, so we've only met twice. The last meeting, we were really looking at data, and the goal will be to take a really good look at that data to make a decision about how we want to move forward. And with CHIP, what they ask us to do is choose the end first is really what you're looking at. So we have to pick a result. An example might be we will decrease the amount of opiate deaths in Waukesha County between ages 25 to 45. You know, that would be an example, but it could be a million different things. So that's what our group is tasked with deciding next time we meet. What is that end result, and some of those indicators that we are coming up with through our through the statistics that we're finding. So that's where our group is at right now. Our next meeting will be a hefty one.
Great, Bree, thank you. I just want to address a quick question in the chat. Dawson asked if there's any access to the list of the 10 factors as well as any related research. Francis and I and Ben Jones and others that have been involved in the CHIP, this work came out of our 2022 work with our CHIP steering committee. And I don't believe we have I'm going to say publicly consumable document at this time. We have information that we have shared with our CHIP teams. But Francis is dumping into the chat right now some of the information. Fantastic. Okay, you are going to love this. Francis, I'm giving you the mic for a second because I want you to share this community health assessment. And folks, everyone has access to this, and there are gobs of information. Francis did a beautiful job on this.
Yeah, so like Bree was saying, the Community Health Improvement Plan, that's what CHIP stands for, came up with 3 really big things that were an opportunity for some community partners to work on. And like she said, substance use is one of them. And so we made this, team with the Heroin Task Force because we didn't think it would be good to have a team working in parallel to the Heroin Task Force. So in addition to that, we have the substance use, mental health, and healthy aging. And we got those from that big document that I just shared, the community health assessment. But then beyond there, the CHIP team identified root causes of health, which were those 10 things that Bree went over, that things that led to healthy aging being a priority, substance use being a priority, mental health being a priority. And if we can start to look at things from more of that root cause system level, then maybe we can start making some real change. One of the hard parts is that working at system level takes a lot more coordination with other entities, which is why a group like Heroin Task Force is so powerful. So feel free to take a look at that document. A portion of what Bree was talking about is on page 42. The bigger document we shared with the team did not quite like publicly shareable friendly. But the information on page 42 does a pretty good job summing it up, as well as the rest of the document.
Great, Francis, thank you. And I really encourage you to look at it. She did a beautiful job collating all this information. She cited the sources of data. So if you're looking for data for other reasons, you can go to more updated, but this was a year ago, so you could go to more updated sources. So thank you, Francis, for chiming in. Bree, thank you so much. Appreciate that. So we will hear more from them as they continue to work as well. Yes, Christine, this is awesome. It is amazing. So take some time and read through that. Now I'm going to turn it over to Francis and to Felicia Benke-Shaw, who are the chairs for the co-chairs for the metrics and measurements team. They have a bit of a data presentation, and they wanted to share some information with you today.
All right, so this is our team. We are small but mighty, and we really have a bunch of data wizards on our team, and we're so excited for the work that we're going to do in 2023. And that work, we identified the problem we're trying to solve already, and that is the lack of standardization, metrics and data literacy among the HTF community partners. And what this, it doesn't help us or doesn't allow us to use effective measurements or progress and identify the priority populations and determine outcomes. As a result, we'll be working on allocating future strategies towards and initiatives with the results that Francis is going to share in just a few minutes that we're really working on this year. We're really targeting our Heroin Task Force community partners and the public with this. And there is a link to our charter in there as well. And I believe these will be shared with everyone so you can see our hyperlinks as well.
Yeah, so like Felicia said, we started off with what problem is the metrics and measurements team trying to solve, and what do we want to see? And so Bree, you'll be happy to know that this group also has to use results-based accountability, so they'll be suffering with you too. We just haven't trained them quite as much as the CHIP group. So our 3 results that the metrics and measurements team identified were that we want shared metrics, were that we wanted to improve the data literacy of this group, and were that we wanted to better support the other action teams, the Heroin Force action teams, through creating some more data focused measurements.
Thanks, Francis. Is this mic sounding okay to everyone?
You bet.
Excellent. So how do we start that? Shared metrics. We did a lot of work around overdose response dashboard. We'll share a couple trends and then some public available data sources. Francis, if you want to move to the next slide. So this dashboard can be found at waukeshacounty.gov/overdose data. There we go. There's a lot of information. This was truly a team effort. There were a lot of people working behind the scenes to make this happen. We used data from our medical examiner, Department of Health Services. And what we really wanted to accomplish here is what is everything that we're doing, who's doing it, and what are some of the results of what we're doing. So what we did was we mapped all of the activities that we're doing and all of the partners that we're doing it with. Excuse me. So the intent here is that on a quarterly basis, some of this data will be updating. Some won't change, but some will be updating, and on a quarterly basis, we'll put the new data into this so you can interact with it. You can see what's happening. If you want to see where naloxone training locations are, they're all there. Number of individuals trained, where outreach events have taken place, where we're doing online awareness campaigns, what the results of those campaigns are, where we're sending campaign kits to schools. So it's really, everything's in there. And then along the bottom, it kind of gives a little bit of how many individuals have we trained? What are some of those stats? 84 community partners and things like that. And as you scroll down on this page, you're going to see an infographic. Hats off to our marketing folks who put this together to make this information condensed and accessible and consumable. So that's a little bit about the work that we've done on the overdose response dashboard. I invite you to come back over time, follow up, see what changes are happening and what we're doing. Some of the trends that we've seen, you can go to the, good segue, Francis, you can go to the next slide. Some of the trends that we've seen around the number of fatalities, number of naloxone trainings, and number of naloxone administrations. We can really easily see that naloxone administrations are having a big impact in reversing overdoses. And that's a pretty big number when we see the number of overdoses reversed since 2018. That's a lot of lives saved. And then in our training locations, where are we doing those trainings? So that's a little bit about what we've created for a dashboard for Waukesha County. You can advance to the next slide. This is the Wisconsin DHS site. There's a lot of really good information here. You can see different counties, how we compare, how we stack up over the course of time through the years. So I'd invite you to go there. That is at dhs.wisconsin.gov/opioids/dashboards. And then we added a link on this slide deck to the Heroin Task Force database list. So these are publicly available data sources. I invite you to go use them, and looking forward to doing more.
So this is just the start of it. We find that people aren't sure where to find data. So we just started creating some and putting it in an easy to find place. So this will be available to you too.
I will turn the mic over to Nicole.
Great. Okay, so hopefully you can hear me. So our second area of focus, or that second bucket that we wanted to focus on, was improving data literacy for all the members of the Heroin Task Force. And we wanted to kind of attack this in a few different ways. So first, our team is working to identify the best way to assess our current data literacy as far as all of the different individuals and groups that are involved in the Heroin Task Force. So there's going to be more to come on this data literacy assessment. So just be watching for that. Second, we plan to provide some small educational opportunities through the large group meetings, such as today, and also in one-on-one meetings with the other action teams regarding some data or specific metrics. And you can actually move to the next slide. Yeah, so that I had mentioned this, the data literacy assessment, more to come on that. That will be coming out in a moment. So one of the things we wanted to do to help start addressing data literacy is we were asked by the steering committee to talk a little bit about some of the main takeaways from the article that was sent out earlier in the month. And this article, in the article that was shared, the authors used a technique of really combining ICD-10 codes, and those are codes that classify a cause of death, along with free text data from death certificates. This was done in order to provide a more precise picture of specific drugs involved in overdoses. And so this was used to look at national overdose deaths from 2016 to 2021, and then also to report on specific 2021 data. So we don't have state level data. Rather, this article talked a little bit about data grouped by public health region. So Wisconsin was grouped with Illinois, Indiana, Michigan, Minnesota, and Ohio. And from the article, we saw that from 2016 to 2021, age-adjusted rate of drug overdose deaths involving fentanyl did triple in their rate. So they went from 5.7 to 21.6. And again, that's a rate per 100,000 individuals. Methamphetamine rate quadrupled, cocaine doubled. We did see a decrease in heroin and oxycodone overdose deaths. When we look specifically at the Midwest, so that region where Wisconsin was located, and we looked specifically at 2021 data, the top 3 drugs that were involved in overdose were fentanyl, cocaine, and methamphetamine. So a little bit different than the national data where fentanyl was number 1, then methamphetamines, then cocaine. In our region, we did see fentanyl was number 1, but cocaine was second for the cause of overdose, and then methamphetamines. We also were able to look at sex differences, and males consistently had a higher rate of drug overdose, approximately 2.5 times the rate of females for all of the 5 drugs that were analyzed in this article. And when we did look at some of the raw numbers in the article, we saw that our region was the second highest for overdose deaths. But when we looked specifically at rates, so the deaths per 100,000 individuals, we were not second highest for rates. We were actually 4th highest for the rate of deaths related to fentanyl, cocaine, and heroin. And we were 7th out of 10 for methamphetamine overdose deaths, and 8th out of 10 for oxycodone overdose deaths. And for the sake of time, we put together a document that you can review, and that just provides a summary of the article as well. So we just wanted to provide a couple highlights from the article, but then also provide you a way to review a summary. And so there's a link that you'll have with this presentation that will allow you to have the summary And it goes through each section, like the introduction, the methods, tells you a little bit more in detail about the results and the discussion of that. So for the sake of time, you can use that to look a little bit more closely at the article. And then if you want to go, I think, to the next slide. So the other piece that we wanted to just get in front of everybody was this idea, again, to help promote data literacy, is this idea of everyone has different comfort level with reading journal articles. And I believe it was Francis or Felicia had come across this article that talked about how to break down attacking a journal article. And so the takeaway is really don't read a journal article from the beginning to the end. One of the better ways to approach reading a journal article is looking at the title and the abstract, and then going to like that discussion or the results section. And then after you've done that, then kind of going through and doing more of a deeper dive throughout the whole journal article. So those are just a couple things we wanted to get in front of everybody as the beginning of our data literacy topic.
And now how we are going to support you. So we're going to provide technical assistance, and we're going to be implementing results-based accountability. So 2 ways we will provide you with technical assistance is, one, we're going to be scheduling quarterly check-ins with each of the action groups. And then what we can help you with is, if you don't know where to start, defining results and indicators, helping find data, collecting data, analyzing data, and presenting your data. And as needed, if your teams find yourself being stuck in between our quarterly check-ins with you, please feel free to reach out to me or anyone on our action team. We are really happy to help and assist in any way that we can.
And then last but not least, I know some people are having some difficulties with results-based accountability. And so recently I came across Brown County using it in a really similar way to us. And so I provided the link that you can check out at your leisure. And I am also happy to announce that we did officially receive the results-based accountability Clear Impact software today. So we will have that for the Heroin Task Force coming up. But in the meantime, if you're really struggling with some of the foundational principles of results-based accountability for your action teams, check out Brown County, because they do a pretty good job implementing this model. And so just another resource for the action team. And that's it.
Fantastic. You guys, thank you so much. The results-based accountability is a framework that we're using both in CHIP and we're doing for our Heroin Task Force action teams. It's kind of here, it's a results-based accountability light, if you will, but it focuses on looking at what do you want to change, what are the outcomes you want to make, and then determining what action you're going to take to make that happen. So we really want to thank all of the action teams and all of the work that they are doing. I also want to just share that behind the scenes, behind the action teams, is a steering committee of a cross-sector group of folks that are supporting them. And these folks, one action team chair from each team comes together with the steering committee to talk about what they're doing and to make sure we're coordinating efforts and not duplicating efforts. So there's a governance team behind that as well. So you guys are doing an amazing job. Are there any questions for any of the action teams before we move forward? And Labrada did just drop in the chat that if there is anyone interested in joining one of the action teams, please reach out to Tristan, our wonderful admin. So I'm going to pause then. Oh, yeah, yeah, Larry. Yeah, sure.
I just want to say there's been a desire by a lot of people in the county to move more to evidence-based decision-making and using data analytics. So I just want to personally thank everybody involved with this. This is such a huge step forward, and I think it's really going to help over the next year or two as we figure out the directions that this task force is going forward. So thank all of you who are here and those who are not for helping us move forward. It's really important, I think, for this task force to have this kind of information. So thank you.
Thank you, Larry. Appreciate it. And thank you to all the teams, Metrics and Measurements. Thanks for supporting our teams and teaching us how to read an article. So that is really helpful as well. At this point, and John, maybe John Kettler, you can help me manage this. We want to give our Heroin Task Force partners a moment to provide any announcements if something's coming up, or if there's something you want to pop in the chat, things that are happening in your world that you want to share with your partners that they should know about. So we're going to pause for a second here to see if anyone would like to just open up and share or pop into the chat.
So I'll go.
Great, Mary, thank you.
It's Mary Simon from Elevate. I just want to remind everybody, if you don't know, we have our fundraiser coming up on July 15th. It is a 5K, 10K, half marathon, and full marathon. If you really want to run 26.2 miles, it's in support for people in recovery from both substance use and mental health issues. You can run in memory of someone. You can run in honor of someone. And you can find more information at adrenalineraces.org, and I'll put that in the chat.
Fantastic, Mary, thank you. How about others, things that we want to make sure everyone knows about? Sonia, good to see you.
Yes, hello. I just wanted to remind everybody about our mental health addiction recovery services at our different locations for Rogers. Every day that I am involved in the community, I understand the need to move quicker and quicker when somebody is voluntary and needing services. I'm happy to be that point person. And a few weeks ago, my brag is that I was able to have somebody do a screening at 8:30 in the morning, and they were able to present to campus right after lunch. So it's just about 4 hours turnaround time for a residential spot. And they did end up needing detox, and we were able to accommodate that. So a few hours before lunchtime, and I was really proud of myself and the whole team for getting things moving. So I just want to throw that out there. And we usually have a summer slump where people would rather be out in summer than programming. So we have the availability if there is somebody in need. So please have them reach out to me.
Sonia, thank you for sharing. That's a great
Yes.
story.
Thank you.
Wonderful. Jim.
Hi, yeah. In celebration of Recovery Month, Rogers is going to open our Friends and Family program, which is available every other weekend for a full day, Saturday and Sunday, providing support and psychoeducation. We're going to open it up to community members. So anyone from any of our business partners in the community that have friends and family supporting someone through addiction, we would love to invite you to come join our program. We will have some marketing material printed shortly, and we will disseminate it at future meetings.
Great, thank you so much. While you guys are still pausing and thinking about sharing, I'm going to share really quickly, and Librata is going to drop it in the chat for us. There are a few things that we wanted to draw your attention to. I sent out with our, I think it was Sunday evening, an article or a report by Forward Analytics, the silent killer fentanyl epidemic in Wisconsin. We recognize this, you as people who work in this world are probably familiar with all of this, but we also thought it was a great report and well written and something you might consider sharing. We also want to draw your attention to the Wisconsin Harm Reduction Conference that's coming up and the Wisconsin Substance Use Prevention Conference that's coming up. And so that will be popped in the chat for us. Thanks, Librata. We just wanted to draw your attention there as well. So I'm going to pause for a second here and stop sharing. Anybody else have anything else to share?
Harry, I'll jump in, with a 10-second, just reiterating the county execs, what he shared earlier. We do have kits, overdose aid kits, or opioid aid kits, as he mentioned, available. They each come with 3 boxes in the lock zone. These are free. Just reach out to us. We also have fentanyl test strips, which we have the Addiction Resource Councils distributing right now. But if any agencies are interested in becoming distributors of fentanyl test strips, we're just finishing a simple agreement for agencies to do that. We can make those available at no cost if any of our partner agencies here would like to distribute fentanyl test strips. And the last thing I'll say is that we have a few successful vending machines, automated naloxone dispensing machines in the county. If there's anyone who thinks they have a location that might be good to host another one, we would be interested in getting a few more vending machines out into the community as well. So just reach out to to the Waukesha County team, myself, Felicia, Kirk, any of the above. Thanks.
John, thank you. Couple of questions came in the chat. I just want to address them. Do you have any of the xylazine test strips?
We do not. We are, we have an interest in that. We are sort of waiting for legislation to hopefully come about. There's some look at that. Again, not an attorney and not advocating or lobbying here, but just sharing transparently. There is a concern that those could be interpreted as paraphernalia. So similar to the legislation that was passed to specify that fentanyl test strips are not illegal, we're hoping for legislation that would simply note that xylazine test strips are also not paraphernalia, and perhaps go so far as to indicate that any other similar thing forthcoming for these novel psychoactive substances would also not be considered paraphernalia. So we're sort of waiting on that, but we would like to begin that when it's possible.
Fantastic. Thanks, John. For oak boxes, please reach out to the link that Felicia dropped into the chat. And it looks like Rogers would host a box. It looks like Jim hopped in there too, Felicia. So maybe you want to connect with him. Sonia popped in herself for future. Where are the vending machines? I think perhaps maybe Janice, we might take that one offline. Is that okay? If John, I don't know if you can address that.
Right now, they're in the
chat.
Oh, it was answered. I see it. Thank you so much. I missed that. All right. Thank you. And thank you, Ryan, for your comment about the legislation. Okay, great.